Every day when I do new intake with patients, I realize that there's a lot of confusion about whether or not someone has Hashimoto's. People will say things like, my doctor never said anything about it, but I've been doing a lot of research and it sure does sound like me. Well, to clear the air, in today's video, we'll help you know whether or not you have Hashimoto's, what sort of testing you need to have done to confirm it, and why it's the stages of Hashimoto's and autoimmunity that leads to such confusion with these kinds of diagnoses. If you're new to my channel, welcome, and if you've been watching my content, thank you so much and welcome back. If you haven't done so already, please consider hitting the subscribe button and ringing the bell. I post videos every single Thursday, and by doing those two things, you'll make sure that you won't miss any of the content. My name is Dr. Brad Bodel, and I specialize in helping people with low thyroid and Hashimoto's lose weight and improve their energy naturally. But the key is always understanding for each individual person what their needs are and what the root cause of their thyroid problems are. Once we do that, and usually it's done through good testing and examination, we can more accurately support what they need and determine what the course of care should look like. So to begin, let's address the easy stuff and give you a clear understanding of the diagnostic criteria of Hashimoto's and what that means for you. To put it real simply, Hashimoto's is defined by the presence of thyroid antibodies. And if you watch some of my other videos, you'll know that antibodies are the proteins that our immune system makes to fight off infections, primarily bacteria, viruses, and parasites. But in the case of autoimmunity, instead of developing those antibodies, those proteins for foreign invaders, we are now creating them for our own tissues and glands, and in the case of Hashimoto's, those antibodies are specific for our thyroid. Now, the ones that we want to look for specifically are called TPO antibodies and TG or thyroglobulin antibodies. Now, thyroglobulin and TPO are just enzymes and proteins that exist within the thyroid gland. And if we have an immune flare-up, we create more antibodies for these proteins, it will start to damage the thyroid gland and impair its ability to create thyroid hormone. But how do we know if these antibodies are present in our system? It's very easy. If we run an expanded thyroid panel, they should have the TPO and TG antibodies included in that panel. That means we don't have to get fancy with special testing. All we have to do is make sure we're requesting the right lab markers, and a simple blood test will tell us whether or not Hashimoto's is involved or not. But if it's so simple, you have to be asking yourself, why aren't more people getting this checked? Especially because we know that Hashimoto's is the #1 cause of hypothyroidism in the United States. The sad truth of it is that our medical system is not designed to look at the root cause of an individual's thyroid problems. Instead, they only assess whether or not you have enough quantity of thyroid hormone in your bloodstream, and if you don't, they're going to recommend thyroid replacement hormone. Ideally, it will act as a patch or it will cover up the symptoms until your next blood test. Essentially, to most doctors, whether or not you have Hashimoto's is irrelevant because it doesn't change the course of treatment. And I can remember back to one of my very first patients. She was struggling with thyroid issues, her TSH was all over the place, and she had a number of symptoms that just weren't resolving. So I asked her to go to her endocrinologist and get an expanded thyroid panel that would include these antibodies. She had it done, and lo and behold, those antibodies came back positive, which to me means that we have to shift and change our mindset for that particular person's care. However, the endocrinologist wrote a note to me because I was still in school at this time that said, "This is an interesting academic finding, but it doesn't mean anything to this patient's course of care." Essentially throwing a little bit of shade at me saying, yep, this is something that we would pay attention to in school, but it's not something that actually matters to us in the real world when we're treating patients. So now that we know that Hashimoto's is defined by the presence of positive antibodies, either positive TPO antibodies or positive TG antibodies or both, and the fact that we know most doctors don't really care about that part of the diagnosis, we have to ask ourselves, where is the disconnect here and why don't most doctors care about Hashimoto's? So obviously I just mentioned that the big disconnect for most doctors is that the presence of antibodies doesn't change the way that they approach the situation. But there's a little bit more nuance here, and it comes down to most doctors don't understand the progression of Hashimoto's. And you know me, if there wasn't nuance to it, I probably wouldn't be doing the video. So let's dig into this a little bit more. If someone's having low thyroid symptoms and they go and get their thyroid panel checked and it comes back with positive antibodies, again, we can say that yes, this person has Hashimoto's. But the question becomes, what stage of autoimmunity are they in? And this is the part that gets kind of confusing, not only for you and my patients, but also for doctors. So here's the deal. Autoimmune conditions like Hashimoto's don't develop overnight. We don't go from turning those genes on and develop antibodies and having no symptoms to suddenly having full-blown low thyroid symptoms that many of us are familiar with. Instead, it's a progression over time where those antibodies slowly eat away and damage the thyroid gland, making our symptoms worse and worse. To define this progression, we categorize it into 3 stages. And those stages are silent autoimmunity, autoimmune reactivity, and autoimmune disease. So when you first develop antibodies, we call this silent autoimmunity. That means if we were to check someone's blood, the antibodies would come back positive, but there is no loss of function, there's no symptoms, and if you were to do special testing, and in the case of thyroid, that would either be ultrasound or biopsy, those would all look normal. Over time, as more and more damage will occur in the thyroid gland, this will progress to autoimmune reactivity, which is the stage that most people find themselves in. So with autoimmune reactivity, we have positive antibodies, we now have major symptoms and loss of function, but our lab testing in regards to the TSH and T4 will look normal, and so will our special imaging tests. The reason why autoimmune reactivity is such a struggle for people who are dealing with it, and why doctors don't know how to respond to it is, 1, they don't check for it, but 2, at this stage of the game, those thyroid hormone levels are normal. Therefore, if our only approach is to do hormone replacement, if we add it at this stage in the game, it's going to push our physiology in a negative manner, and it's going to make you feel worse for a whole host of different reasons. But the problem isn't the quantity of hormone, it's the utilization. When we have autoimmunity occurring, it creates inflammation in the body, and that blocks the binding of thyroid hormone to our cells. So even though there's enough, we can't make that last connection to actually activate our metabolism like we would want to. Lastly is the stage of autoimmune disease. In this stage, antibodies are positive, we've lost function, we've developed severe symptoms, and now our lab testing is abnormal, and so is the special imaging testing. Since enough damage has occurred to physically change the way our thyroid looks on ultrasound, and it also changes those standard lab tests that we always have checked, this is the point where most doctors will come in and say, yep, now's the time that we can do thyroid hormone replacement. Unfortunately, this ignores the autoimmune activity that has been oftentimes going on for many, many years and contributing to someone's symptoms. Doctors are just waiting for these things to get worse before they can apply what they feel is the appropriate type of treatment. Now, if you've been struggling with thyroid symptoms, but your labs and imaging tests keep coming back as normal, let me know in the comments below, and also consider having a conversation with your doctor about whether or not it would be worth it to have TPO and TG antibodies checked on your next lab test. So now that we know that there are stages to autoimmunity and that Hashimoto's is only half of our thyroid diagnosis, how do we tie it all together? And what is that second half, and how do we figure it out? Well, it's actually pretty straightforward. So for each stage of autoimmunity, there's a corresponding level of thyroid dysfunction. Now we know that if there's positive antibodies, we have Hashimoto's, but we don't always know which stage we are in, and we have to make sure we have our second half of the diagnosis reflect that appropriately. If someone has positive antibodies with normal TSH, normal T4, and minimal to no symptoms, this is the stage of silent autoimmunity, and what we call it in regards to thyroid dysfunction is Hashimoto's euthyroid. Euthyroid, spelled EU thyroid, means that our overall function of the thyroid gland is still good. There hasn't been enough autoimmune damage to cause changes in our functionality or the lab levels at this point in the game. The next stage is autoimmune reactivity, where again, we're having symptoms with positive antibodies, but at this point, our TSH may be elevated or it may be normal, and our T4 is normal. This is what we call subclinical Hashimoto's hypothyroidism. So our hormone status looks fine, but it's the inflammation due to the damage of the thyroid gland which is now blocking the utilization of that hormone. It's not a quantity problem, it's a functionality problem. Finally, when we hit autoimmune disease, this is when our antibodies are positive, our T4 levels drop, and our TSH increases. This is when we can actually call someone hypothyroid. Hypothyroid is defined by the change in TSH and T4, not necessarily the change in antibodies. And this brings us back to our absolute biggest problem for most people who are dealing with thyroid symptoms. And that is, most doctors don't think you can have thyroid symptoms until you get to the final stage, which is hypothyroidism, when the quantity of thyroid hormone is low. But the truth is, people can have thyroid dysfunction long before that because it's not always about the amount. Hashimoto's disrupts our entire thyroid pathway. It changes the way we turn T4 into T3. It changes the way that those hormones then activate our cells. Therefore, if we don't address the immune system, if we're not aware that Hashimoto's plays such a profound role, it's going to be very difficult for us to move forward in our advancement of health and be able to support more people. So to recap, Hashimoto's is defined by the presence of either positive TPO antibodies, TG antibodies, or both. The way we can figure out whether or not you have Hashimoto's is by doing a blood test that includes those markers. From there, we can then determine the stage of Hashimoto's by looking at our TSH and T4 levels. But most doctors will not care until you get to the final stage where TSH is high, T4 is low, and we can say you have hypothyroidism and need thyroid hormone replacement. Now, of course, I think it's important to have multiple approaches to these complex immune conditions. But for many people, they either have normal lab tests and continue to have symptoms, or they've been put on medication and they're continuing to suffer. Therefore, I think it's very important that we address dietary, lifestyle, and other natural approaches to help better support your immune system and therefore have better outcomes in regards to your thyroid function. To help you out, I created a free download titled 109 Foods to Boost Your Thyroid and Improve Your Energy. You can check that out at the link in the description box below, and it includes a comprehensive list of foods that I do and don't recommend for people who are starting on their thyroid healing journey. As always, guys, thanks so much for watching this video. If you liked it, hit the thumbs up button and subscribe to the channel. Also, don't forget to check out some of my other content and say hi on social media. My name is Dr. Brad Bodel. I hope you guys are all having a wonderful day, and I will see you guys in the next video.